All right, perfect.
Hello, I'm Saira Iqbal. I'm currently working as a doctor in Wollongong Hospital in New South Wales, Australia. Uh, Thank you, Magnus Group, for giving me opportunity to present this case report. This case report is about herpes simplex virus 1 case vulvitis, which presented with sepsis in a young woman with uncontrolled type 1 diabetes, a multidisciplinary case report. So usually herpes simplex virus is typically self-limiting, but may present severely in immunocompromised individuals. This case highlights an unusual presentation of HSV-1 vulvitis complicated by sepsis in context of poorly controlled type 1 diabetes mellitus. So a 27-year-old female with known type 1 diabetes, her HbA1c was 12%, presented with vulval pain, erythema, and fever. She developed urinary retention due to severe vulval pain. Examination revealed extensive vesicular lesions in vulva and perineum and signs of systemic infection. Catheter was passed to relieve urinary retention. At this point, it was difficult to do the diagnosis, so we sent all the swabs, and HSV PCR swabs from vulva came back positive for HSV-1. Serology was negative for immunoglobulin G, suggesting a primary infection. The patient was diagnosed with HSV vulvitis complicated by secondary soft tissue infection and sepsis. Initial management involved IV cefazolin and acyclovir for 7 days. Upon clinical improvement, therapy was stepped down to oral augmentin duophor and valacyclovir to complete a total 10-day course. Given the patient's poor glycemic control, the endocrinology team initiated insulin optimization, and outpatient follow-up was arranged with her GP and the diabetes clinic. So this case illustrates the potential for severe HSV presentation in patients with poorly controlled diabetes. The overlap between infectious disease, endocrinology, and gynecology care was critical to the patient's recovery. Early identification, multidisciplinary management, and a tight glycemic control were key to preventing further complications. Clinicians should consider HSV infection in differential diagnosis of genital ulcers, especially in immunocompromised patients. This case reinforces the systemic implications of uncontrolled diabetes and the importance of collaborative care.